Low sexual desire is the most common form of female sexual dysfunction, and low desire in general is more common among women than men. This lack of desire isn't necessarily pathological. It's perfectly normal for sexually active people to experience fluctuations in desire throughout their lives. Disorders centered around desire are only considered a disorder when they are both persistent and personally distressing. The most common difficulties related to sexual desire are female sexual interest/arousal disorder and male hypoactive sexual desire disorder. These are characterized by absent or reduced sexual fantasies and thoughts, a lack of desire for sexual activity, and experiencing personal distress resulting from these symptoms. SIAD also includes reduced or absent excitement during sexual activity, reduced genital sensations during sex, and a lack of responsive desire, meaning desire that sets in after sexual activity has started. When partners have different levels of sexual desire, this is known as sexual desire discrepancy. Regardless of the gender, either partner can be the low desire partner. These problems can also be present in same-sex couples or those in a variety of sexual relationships. Desire discrepancies are one of the most common sexual problems, with one survey finding that about 27% of women and 23% of men felt that there was an imbalance in the amount of sexual desire within their relationship. Problems with sexual arousal come in two categories: problems becoming or staying aroused, and problems with persistent and uncontrollable arousal. For women, uncontrollable arousal is known as persistent genital arousal disorder, which is sometimes referred to as restless genital syndrome. This involves uncontrollable sexual arousal that occurs spontaneously. It's estimated that about 1 to 4% of adults experience this with moderate to high frequency. Arousal can last for days at a time, with orgasms only providing temporary relief. This level of arousal can be both physically uncomfortable and impair concentration. Difficulty becoming aroused is labeled as SIAD and may be diagnosed when competent stimulation reliably fails to produce vaginal lubrication and other physical signs of arousal. For men, difficulty with becoming aroused is known as erectile disorder, also known as erectile dysfunction, and this is the inability to develop or maintain an erection sufficient for sexual activities. It's one of the most common sexual dysfunctions that men can experience, especially as they age. It can have both physical and psychological causes, and treatment varies by the cause. Priapism is when an erection lasts for 4 or more hours and is considered a medical emergency. If left untreated, it can lead to a blood clot or severe damage to the penile tissue. This is usually caused by medication or physical conditions, not high sex drive. When it comes to difficulties related to orgasms, people either run into problems with orgasming before they would like to, or they have difficulties orgasming at all. Men are more likely to have issues with reaching orgasm too soon, and women are more likely to have problems achieving orgasm. Premature orgasm is when someone reaches orgasm before it's desired. So it's hard to define what exactly premature means, but according to your book, it might be best to focus on how the orgasms are subjectively perceived. Does the timing cause distress? Does the individual avoid sexual intimacy because of it? If so, then that might be a better indicator of premature orgasm than a set amount of time or thrust. Although this is more common among men, this condition can also occur in women. Some researchers speculate that this isn't a disorder at all, but is the result of adaptive or psychosocial factors. Women who have either an inability to reach orgasm or a greatly delayed orgasm during sexual activity may be experiencing orgasmic disorder. This is common and can either be a lifelong condition or situational. It's worth noting that heterosexual women who don't reach orgasm from vaginal penetration alone are not considered to have this dysfunction. It's normal for women to not orgasm from vaginal penetration alone. Lastly, we'll talk about delayed ejaculation, which is when orgasmic disorder affects men. It's less common than ED or premature ejaculation. Typically, men experiencing this can achieve orgasm through masturbation, but either experience delayed or absent ejaculation during intercourse. The two main sexual pain disorders that men experience is phimosis, which is a condition where the foreskin of an uncircumcised man is too tight, which makes erections painful. The second disorder is Peyronie's disease, which is a buildup of scar tissue around the cavernous bodies, which results in severe curvature of the penis and makes intercourse difficult and painful. For women, painful sex is more common. Genitopelvic pain or penetration disorder is when a woman experiences pain in anticipation of or during vaginal intercourse, or when vaginal penetration is difficult. Dyspareunia refers to any type of pelvic or genital pain that occurs during sexual arousal or activity. STIs may cause this, but can also be caused by infections of the Bartholin's gland, yeast infections, smegma under the clitoral hood, or from vaginal scars and tears. Inadequate lubrication, allergies to latex condoms, and irritation from spermicides can also cause pain. Psychological factors can play a role too. Studies show that women with dyspareunia are either distracted from sexual stimuli or try to avoid it. Although it's hard to tease out whether distraction and avoidance are the cause or the consequence of painful sex. Vaginismus refers to situations where the lower third of the vagina exhibits sudden and severe contractions during any attempt at vaginal penetration, which makes intercourse difficult and painful. These contractions are involuntary and can also affect the person's ability to insert a tampon or to have a gynecological exam performed. Not everyone with vaginismus experiences involuntary spasms. Other symptoms include muscle tension of the pelvic floor, pain with penetration, and anxiety related to fear of penetration. Vaginismus is usually a conditioned response, and it develops from a chronic history of painful sex. It can also develop from chronic relationship problems and past experiences with sexual coercion or assault.